So one of the unfortunate things that can happen with filler is that it just has gone too far. And Zac Efron's been all over the news because people are wondering if he's had some sort of enhancement. And so if we look at a before photo and then a today photo, we see that there are some significant changes that are making him almost unrecognizable in different areas. So for example, in his before view, we see a nice chin proportionate to his face, not as sharp of a jawline perhaps, and definitely not a protruding angle. And now we see that somebody has enhanced the lateral angle of his chin. Now men do get a little more lateral growth of the jaw over time, but this looks significantly enhanced. And unfortunately, it's not contributing a positive to his appearance. He now looks out of balance. He's much wider on the bottom. His chin has now been squared, and even his lips look different than what they were from the previous photo. So some of the enhancements that are made aren't necessarily positives. Even though he has more volume, it's not that he looks more youthful, and I wouldn't say that it's added any attractiveness to his appearance. Here, we would say perhaps he has a little bit of volume lost through the cheekbone arch, but that, again, it doesn't distract, it doesn't detract from his appearance. You don't necessarily have to enhance something just because it's not as full as somebody else's. For him, this worked. So, and one of the questions patients will always ask is, well, how could that happen? These people have limitless abilities to find great surgeons and injectors to help create their aesthetic ideal. Well, sometimes what somebody needs is somebody to see their face a little more critically than what they're seeing and help to say no. And sometimes saying no more filler is a better option than going to somebody who's just going to put filler where you want it. So I think that it is important to go to somebody whose aesthetic ideal jives with what you're looking for. If you're looking for natural, you want to see that in the before and after results, that the patients still look natural. I always tell everybody, this isn't a haircut. This is something that we're doing that's going to be long-term, and it's a change that we want to make sure fits your face. So more is not necessarily better.